Ortiz, CEO of the Crystal Run Ambulatory Surgery Center here in Middletown, New York. I'm also the proud co-host of this year's summit. If you've never attended before, this is the one to come to. As a community, we welcome everyone, professionals, students, executives, and allies. NALI is where bold ideas are exchanged, where connections are built, and where leadership journeys accelerate. It's more than a conference. It's a talent powerhouse.
We're coming together to explore what's next in healthcare, from executive wellness and clinical innovation to advocacy and community impact. As we navigate these important conversations, I hope we also find time to connect on a more personal level. If we haven't met yet, I'd love to introduce myself while we're there. Let's talk leadership, strategy, and anything you're passionate about. That is part of what makes NALI so special. A home where community, purpose, and opportunity thrive. Juntos somos más fuertes. Together, we are stronger.
Hello, everyone, and thank you for joining us. I'm Dr. Isabel Pacheco, and I'm the incoming CEO for Michigan Health Information Network and President-elect for the National Association of Latino Healthcare Executives, NALE. It's such a pleasure to be here with you, with all of these aspiring leaders of La Mesa. You are in for a real treat. The healthcare industry is evolving, and so must its leadership. But for many Latino professionals, the path to executive leadership can still feel unclear, isolated, or out of reach. That is why NALI was created, to serve as a vital platform where Latino and allied healthcare leaders connect, grow, and advance. NALI is committed to equity, representation, and excellence, not just in words, but in action. Through mentorship, leadership development, and intentional networking, we create opportunities where they haven't always existed. And that's the heart of La Mesa Emerging Leaders, a space we created to support the next generation of healthcare leaders. It's where early career professionals gain tools, confidence, and connections to rise, and where seasoned leaders give back by opening doors. Today, you'll hear real stories of leadership, perseverance, and purpose from those who are paving the way and from allies who stand beside them. Because leadership is strong and stronger when it's inclusive, and the future of healthcare demands it. Alexis, I'll hand it over to you to get us started.
Gracias, Dr. Pacheco. Hi, everyone. Welcome to today's LinkedIn Live event. I'm Alexis, and I'm so excited to be here with you on behalf of La Mesa's Emerging Leaders Program, a program created to support, guide, and elevate early career professionals in healthcare leadership. Today, we're shining a light on some amazing individuals who are part of the La Mesa Emerging Leaders Program. They are rising stars, students and early careerists who are stepping into leadership with passion, purpose, and resilience. La Mesa started during a time of uncertainty, right in the middle of the pandemic, when students and young professionals were reaching out, looking for clarity, guidance, and connection. It became a safe space to grow, to learn, and to be seen. Now, La Mesa continues to be a place of development, powered by our incredible community and partners, and driven by a shared commitment to leadership, representation, and excellence. Today's conversation is about purpose. You'll get to hear stories, advice, and perspectives from future leaders in healthcare. These voices matter, and we're proud to share the virtual stage with them. So let's dive in. I'm going to go ahead and start with introducing our speakers one by one. Melissa Alamilla-Arismendiz. Can you tell us a little bit about yourself and what inspired your journey thus far in healthcare?
Of course. Thank you so much, Alexis. Good evening, everyone. My name is Melissa Alamilla. I'm originally from Indianapolis, Indiana. I received my bachelor's in health services management from IU Indianapolis in December of 2021. After graduating, I began working as a program coordinator at the Indiana Immunization Coalition, where I helped increase access to vaccines for vulnerable populations, including those uninsured, immigrant, and refugee families. That experience really deepened my desire to grow as a healthcare leader, which led me to pursue my MHA at IU Indianapolis a year and a half later. During graduate school, I held several internships with organizations like JWM Neurology, the Indiana Department of Health, and Eskenazi Health, all of which really strengthened my passion for healthcare and equity. I recently completed my MHA this May and relocated to Cincinnati to begin my administrative fellowship at Cincinnati Children's Hospital. Now, what truly inspired my journey in healthcare has been my lived experience just navigating the healthcare system alongside my mom, who has managed several chronic illnesses throughout her life. Since the age of 8, I've accompanied her to countless medical appointments to serve as her medical interpreter. And at the time, language services were very limited, and she relied heavily on me to understand her care. I'd say that responsibility really shaped me, and to this day, it continues to drive my passion for health equity. I've made it my mission to ensure that no child has to carry that burden ever again, and that every family, regardless of their language or documentation status, can access the health care they deserve.
Thank you so much, Melissa, for sharing that with us. You're incredible. I'd like to welcome to the stage Adrian Caraves.
Hey, thank you for having me. You want me to introduce myself, I'm guessing?
Yes, can you tell us a little bit about yourself and what inspired your journey thus far in healthcare?
Of course. Like Alexis said, I'm Adrian Caraves. I'm from Galveston, Texas, and my journey in healthcare really started. I studied public health at the University of Houston, and then I became a public health educator with the Houston Health Department. After a few years in the workforce, I had a conversation actually with an early careerist. I don't know if she's on the call, but Stephanie Kabachka. And she gave me really good advice on strengthening my perspective on healthcare. And it really stuck with me, the conversation we had. And so from there, I took a leap of faith. I left my full-time job and started the MHA MBA program at the University of Houston Clear Lake. And since then, I've put my faith in God, and I've completed 5 administrative internships now. And every experience has been such a great experience. And so thanks to one conversation I had with an early careerist, my life has changed.
Thank you for sharing that, Adrian. Next, I'd like to welcome to the stage Jonathan Navarro. Please share a little bit about yourself and what inspired your journey.
Hi, everyone. Thank you, Alexis. Thank you, Adrian, Melissa. Beautiful stories. My name is Jonathan Navarro. I am a project manager at DHR Health at Doctors Hospital Renaissance in Edinburgh, Texas. So what inspired my journey into healthcare? I started with a bachelor's degree in exercise science. I think going into that, I wanted to go into clinical work, wanted to become a physical therapist, but after reevaluating, reflecting, I kind of shifted. And so I got a job at the local hospital in patient experience. And so there I got to interact with patients on a daily basis, talk with patients, learn their stories, good, bad, evil, whatever it was, super impacting. And that's what really fueled my purpose into healthcare. And so I wanted to give back to my community. And so I pursued my master's degree in health administration at the University of Texas, Rio Grande Valley. I'm currently located in Edinburgh, Texas. And so the southernmost part of Texas. So the population down here is highly dense Hispanic, Latino. And so I'm proud of where I'm from. And so, but after completing my during my health administration and graduate program, I got the opportunity to go to Mayo Clinic and serve as an intern there. And so there I got to learn from many mentors. And so one thing that I continue to look back on and learn from there was that the patient comes first. And so I think that instilling that value into myself. And so I want to keep pursuing healthcare and lead with selflessness and integrity.
Thank you, Jonathan. That's incredible. Next to the stage, I'd like to welcome Candelaria PahuaOros to share a little bit about herself and what inspired her journey thus far in healthcare.
Hi, thank you so much, Alexis. So what inspired me to be in healthcare was through my lived experience being the translator in my family and being able to navigate those healthcare situations and scenarios in real life. And that really impacted the path that I was on in high school. I did the health pathway, and in my bachelor's, I did health science with a focus on health education, because it's so difficult to be able to navigate all of those nuances in healthcare all on your own, and people do need support. And then I realized once I finished my internship at a local hospital that I wanted to do more. And I started off my career there while also doing work as a community health worker, being that front lines, boots on the ground type of person in my community, especially in rural health. We see a lot of barriers to access, such as transportation and difficulty at having access to specialty services. And so that's kind of what helped shaped me to lead more into the rural health space. And I was able to obtain my MBA in healthcare from Northern Arizona University. Go Jacks. And it was very beneficial to be able to see the administrative side and to move the needle that way in terms of policy and be able to see processes and being able to explain that in a more plain word version to patients, so then they would be able to have that understanding entering in to our services. And now I'm a health educator where I cover 16 different counties in Northern California, specializing in rural and frontier populations. And I talk about cancer prevention and education and diagnostic services, because if you do obtain one of those cancer-related diagnoses, that's already a big enough decision that worrying about transportation and who's going to watch my child is already on a long list of to-dos. And so I love the meaningful impact and work that I get to do.
And we're very grateful for you. Thank you, Candy, for what you do. I would love to welcome to the stage Gabriela Mata. If you could please share a little bit about yourself and what inspired your journey thus far in healthcare.
Thank you, Alexis, and good evening to everyone. My name is Gabby Mata. I am born and raised from Houston, Texas. My story is fairly similar to Jonathan's, where my background is in kinesiology. For a few years, I was pursuing physical therapy, and there wasn't going to be a life without physical therapy. And now here I am. My story has pivoted just slightly. I couldn't see myself outside of healthcare, so I continued with my master's in healthcare administration and business administration, and I'm currently a candidate at the University of Houston Clear Lake. I'm actually classmates with Adrian. And I've continued to work as a physical therapy tech at Houston Methodist Clear Lake, where I get to experience the clinical side without the pressure of knowing that I have to be a physical therapist. I've learned that I can pivot and transform within the administrative space and still continue to be patient facing. And that's what I'm working on now. It's finding that path that'll allow me to do both.
Thank you, Gabby. I really appreciate you sharing that with me. That leads me into my next question I'd like to ask Adrian. What does success look like to you in this stage of your career?
Of course, and thank you, Gabby, for the shout out. We are classmates. But this question, everyone's definition of success looks different, especially where they're at in their career. But at this point in my career, success is really for me about showing up, learning as much as possible, and just being someone people can count on or rely on. One saying I love, and I say this all the time, is that you can fake caring, but you can't fake showing up. And so, what I've been trying to do is show up to in every room with the mindset of trying to learn as much as possible. I'm okay with being the dumbest guy in the room because I'm learning the most. And so, whether that's through mentorship in Nali or internships at top health systems, I know Jonathan mentioned Mayo Clinic. I interned at Cleveland Clinic. And so just being in these rooms where decisions are being made has been a big impact in my life. Also networking, especially through Nali, this could easily turn into a summit promotion because of how great the summit is every year. And so being around the people that are doing the kind of work I aspire to do has been amazing to, again, be a part of. But I'm also mindful of the progress I've made. So, for instance, Nali through La Mesa afforded me the opportunity to be certified as a Lean Six Sigma Green Belt through the La Mesa program. Another thing is growing in places that I used to avoid, like say Excel. I remember Gabby. We were in a business case competition, and she's actually the one who taught me how to do formulas in Excel, and that was last year. And now I'm at the point where I'm the go-to person to streamline Excel reports. And so just to see the progress I've made in less than a year, it just goes to show how much can happen. And as much as I'm working on myself, I also keep in mind and look around of who I can bring along for the journey and help them improve in any way, whether that's through connecting them to an opportunity or connecting them to the right person. I think success is also about helping others achieve when no one's watching. And so, success, to sum it all up, in this stage of my career, looks like this. It looks like showing up, being teachable, and doing the work. And I think if you can live by that, being coachable, accountable, respectful, and engaged, I think so many doors will open for you, just like they've opened for me. So I'm a true testament to that. And so right now I'm not looking for the titles or to build my resume to the point where it looks impressive. I'm more so trying to expand my toolkit and be prepared, be someone who shows up and who brings others along with them, because in the long run, this is the kind of leader I want to be. And so I'm setting up the foundation to be that leader.
Thank you, Adrian. It's all about showing up and opening doors and leaving them open for the people behind us. Definitely. On that note, I'd like to ask Melissa, for you, why is representation and visibility important to you as a future leader?
Thank you, Alexis. For me, I'd say representation and visibility matters most because I would say I feel what it's like to be unseen, especially in systems that aren't supposed to care for you. For years, as I had shared briefly during my introduction, I served as my mom's unpaid medical interpreter. I always joke with her about that. And not because I was trained, but because there was no one else. Since I was 8 years old, I sat with her besides her exam rooms, translating complicated medical jargon that I barely understood myself. And really, I just watched her sometimes just feeling so confused and in fear of really asking questions because she didn't have that health literacy. And just again, she would feel that simply because no one in the room spoke her language, looked like her, understood her lived experience. And whenever she did receive care from someone who looked like us, someone bilingual or culturally aware, that experience was drastically better. That contrast, I'd say, taught me that leadership isn't just about titles. It's about presence, empathy, and advocacy. It's about being a bridge between systems and the people that those systems were never built for. Representation ensures that decisions aren't just based on data, but informed on lived experiences. It means policies are created not just for patients, but with patients in mind. It creates more human, inclusive, and equitable healthcare. But representation alone isn't enough. Visibility matters too. And by visibility, I don't just mean being in the room. I mean showing up authentically yourself, not shrinking ourselves to fit into any systems that, again, weren't made for us. And as Latinas, when we speak up, when we carry our stories, our names, our accents, we challenge the narrative of who gets to lead and how. And now I'd really like to share an example of how this came full circle for me. And Adrian, I fear this will turn into a promotion. Last year, I attended the annual NALI Leadership Summit, and while I was in grad school. And at that time, I was exploring a few fellowships. But coming from a tight-knit Hispanic family and being raised by a single mom, I'd never even considered leaving my hometown. Moving away for career opportunities just wasn't something people around me did. And really, during that summit, I'd say that everything shifted for me. I sat in a session called, and I wrote it down in a post-it note so I wouldn't forget the name, but called Latinas Women's Bold Journey in Healthcare Leadership. And just listening to those women, I had to hold my tears, I remember vividly. Hearing how they navigated challenges, broke barriers, and led boldly, I saw what was possible for me for the first time. I realized I was the only one limiting myself. Their stories gave me permission to really just dream bigger. And after several powerful conversations, I left that summit inspired to take a step I never thought I'd make. And that's what led me to apply to fellowships outside of Indiana. Today, I'm living in Cincinnati, pursuing an administrative fellowship at one of the top pediatric hospitals in the country. And if you tell me a year ago, I would not believe that, not even leaving my hometown. And I'd say that's the power of representation. Sometimes all it takes is seeing someone who reminds you of yourself to realize what's possible. Because I know how important visibility is, I also decided to apply to the Mesa program. I wanted exposure to like-minded individuals, like my peers here, to hear different perspectives and to grow alongside a cohort of people who are just as committed to equity, leadership, and cultural representation in healthcare. That mentorship that we've received through La Mesa has really been transformative, being able to connect with executives, individuals all across the country. It helped me see that I'm not alone in this journey and that our collective voices are powerful, especially during times like right now. That's why I show up, not just for me, but for every young Latina who needs to see herself reflected in leadership. Because in the end, visibility isn't just about being seen. It's about making sure our communities are never invisible again. And for me, being a future leader means continuing to show up, speaking up and opening doors for others, for our people. Visibility isn't just about being seen, but it's about making sure that others feel seen too.
Melissa, you are an inspiration. Oh, you got me.
Oh, no.
You are incredible. And that's the connection we need. And so with that, Candy, how has being a part of La Mesa helped you? Oh, you suck. Helped you connect with other professionals and that impact. Oh, Melissa, you're incredible. But Candy, I'm going to give it to you.
Thank you, Alexis. When I think about my journey as a first-generation professional, it's reflecting back on my journey of having to push through and moving forward when everything felt uncertain or heavy on my shoulders because I didn't know who I could relate to and get advice and insight and feedback. because I'm the first of my family to get a bachelor's degree and the first to be able to go to graduate school. And so it definitely felt like I was alone in this journey. And I didn't want to let my friends and family down. And it was through my MBA program that I found out about La Mesa Emerging Leaders Program. And it definitely felt like a breath of fresh air where I was able to be in a group with like-minded individuals and be able to listen to their experiences and their stories. And I could relate because we were going through similar experiences. Even when we're time zones away, it felt like I wasn't alone, and I could really push out the idea of imposter syndrome and self-doubt that kept echoing in my mind. And as I get to step into healthcare administration, it felt both really exciting but overwhelming of all the tasks and everything that were before me. And it allowed me to kind of figure things out and learn how to network and how to find mentors and being able to navigate all of those challenges. And I no longer felt like I was isolated, no longer felt like I was alone, and that I truly did belong in the rooms that I had the opportunity to be in. And be able to share my background and my experiences. And I didn't have to explain why representation matters, why these barriers exist. It definitely felt like I was stepping into la comunidad with those around me. And it was one of the most powerful things that I ever had the ability to do was to join La Mesa Emerging Leaders and to be able to receive such wonderful opportunities. Like Adrian had touched on, the Lean Six Sigma certifications. I was able to have that skill set and build upon those leadership skills that I got through my MBA in healthcare. And not only that, but it also kept going with other opportunities like the Korn Ferry Leadership U for Humanity program. And it led me to embolden myself to step out of my comfort zone and become more involved in my local NOLI chapter here in Northern California, where I get to sit on the volunteer committee and help identify these volunteer opportunities for our members to be able to give back to the communities that we are able to service and be able to help out patients more and more. It was definitely the right step for me to be in La Mesa Emerging Leaders and to be able to find this community that understood what it means to be a first generation and to carry all of those hopes of our family and friends, but not just for ourselves, but for the community behind us. It definitely felt like I belonged. And it's still in my mind, and it reminds me every day that I'm very grateful to be a part of such accomplished professionals and these inspiring peers and colleagues to be able to continue creating this path of this bold vision and these ambitious actions that we are leading to have a lasting impact and a meaningful community impact in the patients that we serve all throughout the different states that we're across. And so it has definitely shaped my journey for the better and has allowed me to step out of my comfort zone and dive even deeper into my advocacy work locally here. And so I love that I was able to find such an incredible opportunity and move forward in this journey of healthcare administration.
You are right. You guys are advocates, you are pioneers, you guys are visionaries. Being first generation isn't just a milestone, it's a movement. And you guys have created that and you've provided the space for others. So thank you for sharing that, Kendi. On that note, I'd like to ask Jonathan, what advice do you have for your fellow early careerists navigating uncertainty during challenging times? Is there a value or a mantra that helps guide you through those moments of adversity that you can share with us?
Thank you for that question, Alexis, and super powerful story so far. I'll kind of break this question down. It's a tough question to answer, given that I'm an early careerist myself, and I'm talking to other early careerists as well. Maybe some going through university, grad school, or some that are senior managers, senior leaders on the call. But the first thing that comes to mind is when navigating uncertainty, some of the hardships that I personally face is unclear pathways, right? I think when I first was going into my undergrad or growing up, my parents always taught me, go to school, get an education, get a job, and do this XYZ. And so, you follow the path, but sometimes you don't have others to lean on. So it did feel sometimes lonely. It was going through school where you felt you couldn't reach out to other people, or other people were in the similar situation. And so, but I went to undergrad in exercise science, and now I'm a project manager in revenue cycle management, going through reporting, leading meetings, and doing all this stuff. You would ask me back when I was 19, 20, I would have told you you're crazy, but here I am. And so what some advice I could give is lean on your mentors, right? Whoever that is, it could be family members, someone that is not related, someone that maybe in a different industry than yourself. One of my biggest mentors is huge in the exercise science realm here in South Texas. And so he inspires me on a daily. And so we've had talks, personal talks, and it's just super empowering. And as we navigate through uncertain times, right? So, and then the other thing is ask feedback. Don't be afraid to question things. Ask, hey, am I doing this right? Am I doing this wrong? How did I do in this situation? And so receiving that feedback is helpful, but it's also real, and it helps you learn and grow. The other hardship that I can think about is the pressures to succeed, right? Kind of that ticking clock syndrome. I think as we navigate, as young professionals navigate, especially this economy, and so navigating through that, you kind of want to rush into things, and some of the opportunities that you get, and some of the opportunities that you get to learn from, you have to cherish those, and sometimes you can skip by and not self-evaluate, not self-reflect. And that's one piece of advice I can give is slow down, self-reflect, think about what you're doing right, your strengths, your weaknesses, and really evaluate where you want to go. And when that next opportunity comes in, you know what you're good at, you know what you're not so good at, and you can use that to succeed in that opportunity. The last thing that I have on this topic is feeling underqualified and the self-doubt, right? So I'm from South Texas, huge Hispanic population down here, right near the border. I did my internship at Mayo Clinic. I had never stepped outside of the Rio Grande Valley, 956. I saw a comment on there, but I had never stepped out of the Rio Grande Valley. So when I traveled to my internship, I was by myself, no family members, no friends, no colleagues or anything like that. So it was uncomfortable at times, not seeing people with similar last name as me, maybe not the same, culture, whatever it have you. But walking into those rooms, I did feel, sometimes I did feel underqualified, or I didn't have someone that was the same, that looked like me to lean onto. So you get those feelings of self-doubt. You kind of question yourself, like, am I good enough to be here? Am I asking the right questions? And am I doing things right? And so it goes back to leaning on mentors. Luckily, I had great mentors there that continue to push me, that continue to challenged me to ask questions, challenge the status quo, right? And so stepping into those meetings, you have to be comfortable being uncomfortable. And so that's something that I learned in some of these discussions that we've had in the La Mesa program. That stuck with me, being comfortable, being uncomfortable, right? When you step into uncomfortable situation, be confident, believe in yourself, and don't forget to challenge others, ask questions, and don't be afraid to step up. But one mantra I live by, I learned this in high school football, and we had it on our lockers. We had it on our practice jerseys. It's burn the boats. I'm sure someone's heard it, but if you haven't, the story goes, Hernan Cortés from Spain took the Spaniards to Mexico, and that's where the Aztec Empire was, right? And so on the way there, they landed. They found that they had very limited resources, very limited supply. So it was either they go back to Spain, right, go back home, survive, or conquer the Aztec Empire and take over Mexico. And so there was a lot of self-doubt, right? There was a lot of questions. And so what amongst the members there. And so what Hernan Cortés did was he burned all of his ships. And so what that did was ultimately just create this feeling of there's no turning back, right? You have to go, you're here, give it your full effort. And so I try to think of that story whenever I'm stepping in uncomfortable situations, or even if it's an opportunity. I believe in that mantra, burn the boats. It's something that I like to look back on. So it gives me self-confidence. It gives me the power to believe in myself. And now I hope that you guys use that as a golden nugget whenever you guys have that next opportunity as well.
Thank you, Jonathan. You're right. Feedback is a gift, and taking a minute to slow down and pause and think about those next steps is usually more important than the actions themselves. On that note, I'd like to ask Gabby, what's next for you? And how can this NALE community support you in that journey?
I love this question because I like to point out that all of my fellow colleagues on the call have definitely inspired me every single time. Hearing them speak is what's helping me move to those next steps. And first off, Melissa, I want to be you next year. I'm currently applying for administrative fellowships. Immensely important right now. That is my next step. After which I will move from the clinical space into the administrative space. I've practiced being with patients. Now I want to practice being in the administrative role. And of course, May of next year, graduation. 2 more semesters left. We're getting it done. I have a very eventful next couple of months, and I'm very, very glad that La Mesa has been able to support and empower me through this mentorship. Like Adrian mentioned, we got a Lean Six Sigma belt. That's amazing. I get to continue that education, an extension outside of that classroom. And they've been so helpful with helping me understand the value of my culture and its role, importance in healthcare. I enjoy being at NALE events because I get to see different people in different settings, in different roles, with different titles, who can relate to me and I can relate back. And every single time it's been super inspirational. I've had plenty of conversations with different mentors, one of which I got paired with through La Mesa, Miss Evelyn Terrell. Big shout out to you. And of course, my day one, who has never stopped supporting me. And he is on this call, actually, Dr. Pat Riley. Shout out to you as well. Thank you for continuing to support my goals and my dreams of placing my passion of being that bilingual person in a role that can be plugged in to any aspect of healthcare. If my younger self is on this call and listening to what I have to say, which I hope you are, remember that being bilingual is your superpower. That will go a long way for the safety of the community. In healthcare, it needs to be another addition. And that's why I'm here along with my colleagues to continue expressing what our stories look like. They don't start out in the same way. Jonathan and I were going to be physical therapists, and at heart, we still are. However, now we're going to be physical therapists in our head in the administrative suite. We can still understand everything that goes on in the clinical setting because of that initial passion that we pursued. I urge everyone to please go to Summit. It's really, really an amazing experience, and it's something I look forward to every year now. And with that being said, Nolly has not let me down. Thank you so much for allowing me to participate in this program.
Thank you, Gabby. And thank you to everyone, all participating panelists. All of your stories were incredible, inspirational, and a sign of hope for those of you out there who are looking for some sort of direction and guidance. Please know that everyone is here to support you. We are all here for you. I'd like to thank everyone here for participating and ask if there's any questions, please feel free to drop it in the chat. We can address it. Please let us know if you want to connect. We're on LinkedIn. Share this live session. I would like to thank everyone for your time and appreciate you all. To our audience, thank you for tuning in. If something resonated, directly connect with our La Mesa leaders here on LinkedIn or leave a comment. If you're an early careerist looking for community, someone looking to support future healthcare leaders, reach out to us. We're here, we're always growing, and there's a seat at the La Mesa for you. I'm going to take a look at the chat before I hand it over for final notes, just to make sure if we have any questions, we can address it. I see one from Rosette Botello. What excites you most about the future of healthcare? And I'll go ahead and open it up to the panelists if anybody would like to answer that.
I can go ahead and speak on this a little bit. Most people who are in current leadership roles say you are going to be the next generation to solve all of healthcare's problems. I don't know that I'm excited about solving problems, but I am excited about taking on the challenges and putting my own twist into implementing strategies and even bringing in my culture. How can my culture improve healthcare? That's what I'm excited to do.
Thank you, Gabby. Anybody else want to share? If not,
I can share. I do like how there's different focuses within healthcare. I know that in the past over at UC Berkeley, there's cohorts that are focused on rural health called the Rural Health Initiative. And so to be able to highlight the special and uniqueness that it is for rural health and that healthcare space, I think that that's very transformative, and I can't wait to be a part of it and be able to kind of see what the future holds for healthcare within rural health.
thank you, Candy. I really appreciate that. And I'm starting to see some of the comments come in. Thank you. Jessica for sharing. Love seeing many of our Nale stars. See you at Summit. Yes, ma'am. Susan Merritt, thank you for joining us. You all inspire me. Keep up the good work. We shall try our best. Houston, thank you. Incredible stories. Definitely. Very honored to be able to share this stage with you all and be able to be a partake in this. And Dr. Pat Riley, it's an honor. Thank you. This is what will make a difference in healthcare. We clinicians cannot make it in the clinic alone. Thank you for joining us, doctor. We really appreciate you, and we're honored to have one of your stars with us as well. And Rosette Botello, thank you. I love that. A Chicano doctor once told me culture is prevention, and that has stuck with me. Yes, it is. Dr. David Hayes Batista will forever say it. He sticks in my head. It is all about the narrative. And as long as we can go about our culture and our narrative, that's how we can make a difference. Health outcomes begins with our communities. Thank you. And I'd like to raise and share this question with the panel from Jesus Terrones. Can you speak a bit more about La Mesa and how one can be involved? And I'll open this up to anyone, or I can pick someone because none of y'all can answer it. Adrian, you get to pick. You get to answer.
Yeah, I mean, La Mesa has been great. I think, who brought it up? Jessica brought up the STARS program, and Gabby and I know we're part of the STARS program at Summit last year, where we volunteered at every session. But La Mesa is that times 10, because what we got to do was get to know each other over the past 6 months. I want to say it's gone by so quick, but we've heard from so many leaders within healthcare who happen to be Latino, and they've shared their stories and inspired us in ways that I personally could have never imagined, to be inspired even more. But just being around like-minded individuals, we also were afforded the opportunity to get certified in Lean Six Sigma. We also did a book club, which is super fun. I believe we're meeting the author of the book, Veronica Villarreal, and so that'll be amazing. How to get involved? I say reach out to our La Mesa email, or any. Honestly, if you go to Summit and you ask about La Mesa, everyone's gonna know what you're talking about. And so it's gotten to that point where people are, especially emerging leaders and early careerists, are wanting to be a part of La Mesa. And so the good thing about La Mesa is it's a big table and you can pull up a chair. And so if you come to Summit, please ask if you're interested.
Adrian, thank you. On that note, I'm a graduate of last year's program, the 2024 cohort, and it was honestly life-changing. And not only the connections I made with, including some of these panelists right here today, to my own cohort, it has allowed me to expand my network, my ability to understand the perspective that I bring to the leadership role, especially here in my current role at IEHP. It has been an incredible opportunity to learn the visibility I can bring to our community and the work that we do. I also like to highlight my personal connection, Michelle Linares. She's what led to me to my tears, Melissa, because that's what gave me the inspiration to be and feel seen in a room. Knowing that you have that presence, visibility, and responsibility, I really appreciate the ability to instill that in the future generation and project that. So thank you for highlighting that. I'd like to highlight the next question that I see in the chat from Liliana Chavez. What's one change you'd like to see in how healthcare leaders are developed or supported? And I'll go ahead and direct this question to Melissa.
Yeah, Liliana, that's a wonderful question. I'd say one change I'd like to see, especially in my fellowship that I've been able to experience, is just providing more education about culturally competent care. I think to a lot of the stories that we've heard today is our lived experiences, how we struggled with having an interpret at such a young age, having to understand medical terms in two different languages. And so I think one, being able to help out with that literacy, but also, again, that cultural aspect to it. Everyone receives care differently. Different religions, different cultures. And so I think understanding a little bit about that and kind of how our expressions might be, what that means. And so when you feel represented, heard, or that your experiences are seen and understood, I think that ensures that you feel comfortable with the care that you're receiving, and ensures you that you ask those questions. Culturally, everyone receives healthcare differently, and so just creating a space where individuals decide how they want to receive that, and just providing that training. Culturally, I mean, that's something I'm really learning a lot about, and something that I'm actually prioritizing throughout my fellowship, being able to learn about different cultures, what's important to them. Like something I recently learned is not all religions accept blood transfusions, and like just even being able to understand that. And when you're talking to patients, when you're talking to different individuals, you already have that sense of, okay, culturally, this is how they believe and receive healthcare. How can I be more careful with my words, recommendations? I think that's a huge part of healthcare. Not everyone receives that aspect. You know, the healthcare system isn't built for all individuals that look like us. However, if you add that cultural aspect to it, take a minute of just doing yourself self research about different cultures and embedding that into your healthcare, I think healthcare and your healthcare practices, sorry, I think that goes such a long way. And so definitely I've been able to see that with my mom, even having physicians that maybe aren't Latinos, but understand that maybe she's a single mother, so she's not able to make a early appointment, and just having that aspect, feeling seen, it makes or breaks your experiences in healthcare. And already for a lot of minorities, immigrants themselves, I think they fear to seek attention, seek help for healthcare. Maybe they fear about, you know, having to talk about their immigration status, that might be reported or anything like that. However, if you're able to really perceive that and interact with them with caution and understanding how they're feeling, their fears, their hesitancies, you're able to provide care that's more culturally comprehensive and just more caring, and ensure that every single individual that seeks care receives it in the way that they also want it, I'd say.
I couldn't agree more. Cultural competency is the bridge to improving health outcomes in our community, hands down. That's incredible. Thank you, Melissa. And I did want to share one more thing I forgot to mention. La Mesa is a national program where NALE accepts 25 early careers across the nation. And that's where we're kind of coming together to support ourselves in mentorship, fireside chats, and as they've mentioned, professional development opportunities. And with all this, we have so many plates to spin. I saw a comment here in the chat that I'd like to follow with all that from Jackie Cifuentes to all of our panelists. How do you stay true to yourself in professional spaces? And I'm going to add on, while you're balancing all of those phases and versions of yourself. Now I'll go ahead and open it up. I can pick someone again. Jonathan.
All right, I'll take this one. What I usually go back to is what I believe in is my reason for working in healthcare, and I have to go back to it quite a bit because I don't work patient side or clinical. I work in revenue cycle management. So what I stay true to is the patient comes first, and it's difficult in terms of revenue cycle management. I have in my work in healthcare, I have to take a step back and think, how can my work impact the patients? And so keeping that in mind, that's how I stay authentic. That's how I stay true to myself, is going back to the reason why I initially came in healthcare, which is giving back to my community, giving back to my patients. And that's how I stay true to myself.
I lost my mute. Thank you, Jonathan. I really appreciate you for sharing that. I know it's difficult too, especially in these difficult, tumultuous times. I want to thank everyone for sharing your stories. Leadership starts with visibility, and you definitely did that today. Today, we saw what was possible when opportunity meets potential. Let's keep building that together. I'd like to bring back to the stage our honorary special guest and board member, Isabel Pacheco, for our closing remarks.
All right. Wow. What an inspirational group of aspiring leaders. I am simply blown away by all your courage to break barriers and really own your future. I feel so encouraged by the bold leaders you all are and have a deep sense of gratitude knowing that you are the future of healthcare. So thank you. Thank you all for joining us and engaging in this important conversation. We invite you to continue the dialogue and elevate your leadership journey by joining us at the 8th Annual NALE Leadership Summit, taking place September 17th through the 19th in San Antonio, Texas. This year's theme is Bold Vision, Brave Leadership, and Lasting Legacy, which reflects our commitment to empowering Latino and allied healthcare leaders across the country. Whether you're just beginning your career or expanding your executive impact, the summit offers unparalleled opportunities to connect, grow, and lead with purpose. So visit www.nalhe.org, NALHE.org, to register and be part of the movement shaping the future of healthcare leadership. Because juntos somos más fuerte. Together we are stronger. Thank you for joining us, and good night.